Good afternoon, everyone. Welcome to yet another amazing episode of the SBV Connect, the webinar where SBV is reaching out to the whole world, sharing messages of inspiration, sharing messages of goodwill, sharing messages of wellness. Today, we are taking a look at the topic, Student Salutogenesis in Health Sciences University. For today, we have an amazing list of speakers, including the Honorable Professor P. Shyama Prasad Ji, the Honorable Vice Chancellor, Dr. NTR University of Health Sciences, Vijayawada, who will be talking on promoting health and well-being in the university setting and overview. We will also be having an inspirational session from our own Honorable Vice Chancellor of SBV, our most respected and inspiring Professor Subhash Chandra Parija sir, who will be exposing the topic of from healthy education to healthy learning, implementing salutogenesis in educational science. Salutogenesis is a topic that is very close to the heart of SBV. Salutogenesis is a focus on wellness rather than pathogenesis, a focus on disease. Here at Sri Balaji Vidyapeeth, the inspiration is to take the concept of wellness, wholesomeness, well-being to the student community, our SBV family, including our faculty, our staff members, and all the family, and the society at large. Today, we are looking at this topic of salutogenesis. Salutogenesis implies a feeling of complete wellness, which comes from the Latin and Greek, salutare and genesis, where we want to have a sense of coherence, which is the heart of salutogenesis. We want to understand how we can make our life more meaningful, how we can make our life more understandable, and how we can make our life more purposeful. This is the message that today's SBV Connect is sharing with all of us. And it gives me great pleasure today to invite our first speaker, who will be Professor P. Shyama Prasad Ji. To introduce Sir is no mean task, because Shyama Prasad Sir, he is the Honorable Vice Chancellor, the Honorable Vice Chancellor of Dr. NTR University of Health Sciences, Vijayawada, Andhra Pradesh. He has done his undergraduation in 1977 and post-graduation in 1982 from the SV University in Tirupati, and the MCH in Pediatric Surgery in 1989 from the Andhra Medical College, Vijayawada. Sir holds many prestigious academic and administrative positions in his career in so many of the medical colleges of Andhra Pradesh. He has attended 20 national and international workshops and given guest lectures at the Indian Medical Association conferences, including the state and national, for 32 times. In state and national conferences, he's presented 112 papers. We can see that he loves to serve the society as more than 200 camps focusing on medical health, diabetes, cancer in the coastal districts of Andhra Pradesh. And he is a person who walks the talk, having personally donated blood 74 times. He also visits different educational institutions to motivate others, giving them an appraisal on the value of blood donation. More than 40 years of experience in the field of general surgery and pediatric surgery. And he is a well-known examiner for the postgraduate in general surgery at NTR University Rajiv Gandhi Health Sciences University, Dr. MGR Health University, and so many other universities in India. He is well known for social activities and rendering free services to the remote villages in and around Visakhapatnam. He has initiated various social programs benefiting the patient attendees while administering the government and private medical colleges. Of course, with such service, he has received so many awards from Lions Club of Visakhapatnam, the IMA, the Papa Association, Kinara Arts Hyderabad, and the YMCA Award. The Healthcare International, the HIMA Humanitarian Association, and from the Collector of Visakhapatnam, Sir has received the Best Administrator Award. We welcome you, Sir, to deliver your talk on the topic promoting health and well-being in the university setting and overview. Over to you, sir.
Very good afternoon. And today's program, these are my student Salutogenesis and Health Sciences University, promoting health and well-being in the university setting and overview. Health can be created, maintained, supported in the university settings. Health universities has explicitly emphasized the whole system approaches and drawn on socio-ecological theory and system thinking, emphasizing the importance of creating environments and contexts that support and maintain health, well-being, and human flourishing. Although informed by underpinning salutogenic orientation, health universities implementation and research has tended not to be framed explicitly in terms of salutogenic constructs. Higher education, like many other sectors, has witnessed a growing focus on well-being, resilience, and copying perspectives that are not the same as but clearly related to salutogenesis. Universities are complex systems, and in guiding future developments, it will be important that salutogenic thinking inform research, policy, and practice at multiple levels. Sweden Nordic School of Public Health published a paper, From Health Education to Healthy Learning, implementing salutogenesis in educational science. Salutogenesis, by definition by Antonovsky, has been developed as a paradigm in opposition to the pathogenic orientation which suffices all Western medical thinking. Scrutinize the concept of health education, designated as HE, and to broaden the concept of health literacy, HL, towards a lifelong healthy learning concept. The health literacy is a broader concept than health education. The health and education concept puts them into a value system of health promotion, designated HP of Ottawa Charter. It is designated as OC, using a core principles and values of HB and HL and action competence called AC. In the light of salutogenesis, also designated as SAL, the salutogenic theory based on resources and comprehensibility, manageability, and meaningful can be integrated in a learning model. Pupils are seen active and participating, subject shaping their lives to AC method. The combination of analysis of values and intentions of health promotion according to OC combined with existing evidence on the salutogenic approach to health, stemming from a systemic research synthesis from 1992 to 2003 and ongoing analysis from 2004 to 2009 by the authors. In addition, the views from the discussions with participants of section in the NHPR conference 2009 are integrated. The similarities and differences between the salutogenesis, the OC, and healthy learning were shown in a graph. The results of discussions will further develop and strengthen the concept of healthy learning. Health education has been an important pillar of public health. See, the sense of coherence as a lifelong process of development. You see, healthy behavior, stress, chronic illness, life events, interventions. Again, they are seen by perception, good, whether physical, mental, social, spiritual health, and quality of life. It is born on SOC and longevity. Health education and health literacy. Health education is seen as a process, not a product. Traditionally, health education has focused on individual changes towards healthier orientation, especially in a lifestyle research. There are several definitions of health, literacy and differing evaluation of health action. Kicksburg and Mark, a healthy literacy is the capacity to make sound health decisions in the context of everyday life at home, in the community, at the workshop, a critical empowerment strategy increasing people's control over the health, their ability to seek out information, and their ability to take responsibility. See, in salutogenesis, a healthy learning process in the context of health promotion, similarities and differences of salutogenesis, the Ottawa charter and concept of healthy learning. We are characterized by characters, salutogenesis, Ottawa charter, and healthy learning. To start with prologue, it is holocaust in salutogenesis, whereas UN Declaration of Human Rights, WHO Declaration of Health in Ottawa Charter. For healthy learning, the roots of health education, health literacy, and salutogenesis. The time reference is 1979 and 1987 salutogenesis. The theory was status was theory and evidence. Fundamentally is human rights, that is active participation of subjects. Whereas in Ottawa Charter, it is 1986. The principles and ideology, human rights, that is active participation of subjects. A new concept introduced in 2009, theory, evidence, perspective, human rights, that is active participation of subjects. And to come back at the focus, a global life orientation, lifelong learning process, and the core question is the origin of health. What creates health? What are the people staying well? What can their experience tell us about health resources and salutogenesis? Whereas Ottawa Charter, it is a process promoting health through the active participation. Whereas healthy learning is a lifelong learning process. What are the characteristics of a healthy learning process? By definition, salutogenesis, the original definition of salutogenesis and the sense of coherence, Atonowski, are generally accepted. Whereas in Ottawa Charter, there are several and different interpretations of health promotion after Ottawa in 1986. And healthy learning need to be further developed and improved. Key concepts, sense of coherence, generalized resistance, resources in salutogenesis. The resources are again generalized resistant resources. Key mechanism is ability to use generalized resistant resources for the development of a strong sense of coherence. The elements are comprehensibility, manageability, and meaningfulness. Whereas in Ottawa Charter, there are several different interpretation and health motion after Ottawa 1986. Health promotion is important here. Health determinants enable control over the health determinants. That is called empowerment. In healthy learning, needs to be further developed and improved. A healthy and learning determines ability to benefit from a strong sense of coherence from a life learning process. The comprehensibility, manageability, meaningfulness, action competence are important in healthy learning. And approach measurements or salutogenesis, they are contextual systems. Measurement means the orientation of life, questionnaire, The original sense of coherence is 29 and sense of coherence 13 item scales, some modified versions and same questions but with differing scoring alternatives. Whereas Ottawa is the settings are important, different questionnaire with different items depending on the level and dimension explored. Whereas in healthy learning, contextual and systems need to be developed based on the original sense of coherence questionnaire, implementation level and outcome, individual, group and societal and salutogenesis, pursuing a good health, mental health and quality of life. Whereas in Ottawa Charter, individual, group and societal and a better health and active and productive life, individual, group, society, perceived good health, well-being and quality of life, thriving and flourishing. Whereas professional role in salutogenesis serve as a generalized resistant resource, GRR, only measure the sense of coherence. The effectiveness is the global evidence base proves the healthy model works. Whereas in Ottawa Charter, it facilitates and enables us, whereas only risk approach focusing on healthy behaviors, lack of coherent and sound theory. Whereas in a healthy learning, individual, group, social, perceived good health, well-being, and quality of life, thriving on flourishing, facilitation enablers. And misconception is only the sense of coherence. Effectiveness is the global evidence of base proves the health model works in salutogenesis, whereas only risk approaches focusing on health behavior, lack of coherent and sound theory based in Ottawa Charter. And finally, health learning, the same concepts as health education, health literacy, yet to be explored. The health of river of a life, this is a promotion of health, health education, prevention, and protection. A salutogenesis finally leading to quality of life welfare. Whereas some diseases, it is a curative, some diseases, it goes with death and disease. Cure, protection, prevention, and promotion have to work hand in hand in synergy and support each other in order to gain optimal health results. Health in the river life, we already shown in the figure. The salutogenesis research seems to be applied within the disciplines of classic health science, medicine, nursing, psychology, sociology, and social sciences. Educational science is seldom included. Educational sciences is seldom included here. From longitudinal study of a Japanese student, Togari et al. Demonstrate that strong sense of coherence is predicted good physical and mental well-being and a stronger interest in learning. At the Enneagram conference in Ireland, Lundgren presented how the sense of coherence concept could be used in a school context. The OC emphasizes health determinants, HD. These are based on factors that eliminates and risks and diseases instead of positive health determinants. Such healthy risk determinants are perceived and conceptualized through risk management as being in discussion on social determinants for health, health. Salutogenesis presents these determinants as generalized resistant resources. It is designated as GRR that enable people develop their sense of coherence. Towards a new synthesis that is called healthy learning, reflecting on the discourse of public health and education science in historical context, enables a synthesis by juxtapositioning learning and health promotion principle, deconstructing the elements, again reconstructing in the spirit of constructivism, adding a reflection of evidence of regarding effective health education and health promotion. The silhouette of different paradigm for health and education emerges. We conceptualize this as healthy learning. Thank you very much for patient hearing.
Thank you very much, sir, for that excellent exposition of promoting health and well-being in the university setting and overview. the way you have compared and contrasted salutogenesis with the functioning of the Ottawa chapter and the healthy learning concept is a message that we can take home with us. And of course, the river of life is the most important river that we are all swimming in, and we will take that message to heart and take it forward. Thank you very much, sir. Our second speaker, Professor Sudha Seshayan ji, is not able to join us today as she has an important meeting with the ministry. So we are going for our next session, and we have our inspiring Vice Chancellor, sir, Professor Subhash Chandra Parija, sir, delivering his talk on From Healthy Education to Healthy Learning, Implementing Salutogenesis in Educational Science. Our respected Honorable Vice Chancellor, sir, Professor S.C. Parija, sir, is an eminent academician, erudite microbiologist, researcher, keen votary of medical education, and an able administrator. He has served with distinction as the director of JIPMER Puducherry, bringing laurels to that institution during his tenure. He has authored 16 books and more than 400 research papers in national and international journals. It is to his credit and the credit of SBV that as a Vice Chancellor, he has been listed amongst the top 2% of global scientists in the field of tropical medicine. The FAO and the WHO, as an expert member on foodborne parasitic diseases, he has served with distinction, and for his nodal contributions to the development of medical microbiology, sir has received the Dr. B.C. Roy National Award from MCI in the year 2003. He is the founder of the Indian Academy of Tropical Parasitology and has been conferred with various fellowships that include FAMS, FICAI, FABM, and FIMSA. I would like to state at this time that sir has been inspiring every one of us at SBV to take up the concept of salutogenesis and bring it right into the student hearts, as well as the hearts of all the SBV family. We welcome you, sir, to deliver your talk at this point. Over to you, sir. Thank you.
Thank you very much, Professor Balogi Anand. Good afternoon to you all. Esteemed Professor Sam Sundar, Honorable Vice Chancellor, Dr. NTR University of Health Sciences, Vijayawada, and my dear colleagues and participants for our SBV CONNEcT series on webinars. At the outset, on my behalf and behalf of entire fraternity of Sibalaji Vidyapith, and on behalf of our respected Chancellor, CMK Rajgopalan, I extend a hearty welcome to you all for this interesting webinar on student salutogenesis in health sciences in the stage. Today, I shall be taking this opportunity to share some of my thoughts on implementing salutogenesis in our educational science. Is the slide moving?
Yes, sir.
Okay,
Yes,
fine.
sir.
Okay, that's nice. Thank you so much. So now, after an interesting introduction by my colleague, Professor Shams Prasad, on salutogenesis, he has made my job easier. So why use salutogenesis? To explain this concept of salutogenesis, just if I can say it. In our day-to-day life, we have done well, but we can do better with more information. This is the concept of life. We can ask, if not bad, are you good? If not poor, are you rich? If not hopeless, are you hopeful? If not dissatisfied, are you satisfied? If not ill, do you have health and wellness? So these are the most important component of a feature of salutogenesis. Now, in a health sciences, in a medical institutes or universities, we all are contributing for the early diagnosis, treatment, prevention, and better management of the disease. But here in salutogenesis, the basic question, the basic concept we ask to ourselves and to others is, what did you do today to avoid disease? Did you have care, like COVID time? Did you keep your hands clean? Did you maintain COVID appropriate behavior like avoiding physical distance? Or did you have a cough or cold? The same concept we can ask now, even to a normal person. What is the process of life? What is doing today? So that contributes not to suffer from any infectious disease or any disease. So this is the basic thing. Stands on the basic concept that the best preparation for tomorrow is doing your best today. If we are doing best, obviously we are confident we can do better tomorrow. Now, in this concept, I can ask a question. What did I do today? Myself, what I have done today to create health, to generate health. So if we compare again salutogenesis versus pathogenesis, we know when we talk of pathogenesis, pathogenesis, basically when we talk of pathogenesis of a disease, let's see pathogenesis of a diarrhea. What we teach our students, what causes disease, either bacteria, pathogen or fungi. Then if we know that, how to avoid these problems, not getting infections. What is the symptoms? What is the pathology of the disease? And then how to treat the disease. And so that you can again have a normal, healthy life. That is the pathogenesis basic of any disease, either infectious or non-infectious. And what we are now focusing on this concept of medical education or health education across the country, about the globe, is basing on the pathogenesis studies of origin of the disease, That is one lead point which leads to other components. But in contrast to that, the basics of salutogenesis is pragmatically different. We don't ask, in like pathogenesis of disease, what causes disease? What causes health? About approaching a good process for maintaining health and proactive roles for maintaining health, for have a pessimistic attitude, go and get well soon, and discovering how to live a good, healthy life, not yourself, but along with other people are there. And when we talk of the conventional pathology objectives, diseases, first what we talk disease, then we think of the causative agents, either a bacteria, virus, fungus, parasite, and how those pathogens, either a bacteria, parasite, or fungus, they cause the disease. Either they directly invade the human beings, or if they enter the human, how they cause by toxins or any other process, or what are the risks people have to suffer from these infections, injuries, and accidents. So these are the mostly pathology objectives in conventional CONNEcT. But in salutogenic objectives, it is non-pathologics. It shares the importance of the process. It shares the importance of the process of the life. That should include how happiness you are every day. Are you happy? Are you enjoying the life? How much enthusiastic are today to carry out today's life? And excitement in your activities, in helping the people. And of course, how you have got so much hope to live for the future. In essence, compared to pathologic objectives, salutogenesis rests on the main assets of salutogenesis are assets for health and well-being. So what are the assets for health and well-being? Every day, every moment of life, we like to have happiness, enthusiasm, hope for the next day, next year, next moment, excitement that we can have some more good life, healthier life. So this concept of salutogenesis was first suggested by the father of our salutogenesis, Aaron Antonovsky, who suggested to get this concept by telling that this is a process by which individuals maintain their inner coherence. It means sense that life is comprehensible, manageable, and meaningful. Unlike the traditional, the life breaks down, life is lust, life not meaningful. But here in salutogenesis, it is ability to function in the face of changes in themselves and not in isolation, but in relationship with the environment. Father of salutogenesis, Aaron Antonovsky, was a medical sociologist. He coined this term salutogenesis in 1968 to capture this concept on different bases. Here, it tries, even we have asked many times, why did some manage to avoid illness and do well, even when subject to extreme stresses, whereas in a similar conditions, other people did well. So salutogenesis is a derivation of Greek or Latin word as Professor Balogyanand mentioned, from Latin word, salus means health, Greek means source. In combination, it means sources of health. So in essence, there are many concepts, many ways to define salutogenesis. One of the way could be, it is maybe an alternative medicine concept that focuses on factors that does not cause the disease, but the factors that supports human health and well-being. That is what, rather than on factors that cause disease. It's a comprehensive components of factors such as health, like lifestyle, our daily routine and behavior, medical care with the drugs and services, nutrition, and the environment where you live, and of course, genetics. He was able to show in many studies that relatively unstressed people, the people who are not stressed, had much more resistance to illness than those who were more stressed. He argued that the experience of well-being constitute a sense of coherence. This sense of coherence, which has been well described, presented by my previous colleague, previous speaker, Professor Shyam Prasad. Though modern medicine has increasingly come to ask about the origin of illness, he suggested that an equal important question to pose is, what is the origin of health? We must have some good answer for pathogenic disease. He opined that less stressed people had much more resistance to illness than those who are more stressful. And this is because well-being is based on sense of coherence, which is the soul or heart of salutogenesis. And when we compare this basic process of salutogenesis versus pathogenesis, pathogenic model focuses on the sickness, its outcome, its management, whereas salutogenic complex focuses on well-being, healthy life, that's normal health. Sense of coherence, when you talk, it is a global construct that includes comprehensibility, coherence, manageability, and meaningfulness. And that coherence is that express the extent to which one has a pervasive, all-encompassing, enduring, long-lasting, though dynamic feeling of confidence. That's when internal and external environments are predictable, and that there's a high probability that things will work out as well as can be expected. It's a complete, strong, positive, and manageable and comprehensive note. Sense of coherence is the result of the collective effect of resources and processes conducive to health. Within the salutogenic orientation, there is directive relationship between the strength of the sense of coherence and the person's ability to employ cognitive, emotional, and instrumental strategies like to improve coping and thereby well-being. In this concept, when you've done in effective school health policies and programs, when implemented the salutogenesis, outcome will be to focus health and healthy behavior, educational outcomes, health knowledge, skills, and socials, and so much. When we think of salutogenesis, there are many aspects approach that focuses on self-efficacy, empathy, supplemented with humor and gratitude. So now, if somebody wants to know what are the indicators of movement of towards the salutogenesis, it cannot be clearly defined, but there are some components which can give an indication. Is that one is that persistent presence of a support network, expectations, chronic, continuous positive expectations. Another indicators is the tendency to adapt, flexibility to adapt to changing conditions. And another component is rapid response or recovery due to repeated challenge, even following the challenge. And more indicators include like increased appetite for physical activity, episodic peak experiences, experiencing your outcomes, and of course, one part of the component is the sense of spiritual involvement and increased sensitivity to other people's problems. So, in salutogenesis, essence focuses on the component that contributes to the health promotions, whereas disease pathogenesis, it mostly speaks about, of course, preventions, cure, and care. Now, again, to add more and more indicators of movement towards salutogenesis is like tendency to identify and communicate feeling effectively with the colleagues, friends, parents, juniors or seniors, colleagues in your working environment, and that is supplemented by repeated episodes of gratitude, generosity, and related emotions. These are all supposed to be good, positive outcomes of our progress towards salutogenesis. And the most important is that a persistent compulsion, desire to contribute to the societies and contribute to the health of the societies. And now, in this context, now there are many empirical-based educational strategies. That means salutogenesis could use health profession training programs to infuse healthy practice and learning among health professional students. That is what we have been evaluating. We have been experimenting in our universities, Balaji Vidyapith, health science universities, popularly referred to as SBV. So what is the need? Why started? Why to learn salutogenesis under health professional programs? Because we do believe, and we have been trying to substantiate it, that with salutogenesis, thinking and capacity in their approach really shows the difference to patient care and health promotion activities in more humanitarian ways. This strategy is based on years of research and teaching mental health, health promotion, and salutogenesis students on undergraduate, postgraduate, and so on. So any educational strategies that aims to teach salutogenic practice need to be based on stance that salutogenesis represents, and it should comprise salutogenesis as a body of knowledge. And most important, it is not for 1 day, 1 month, or 1 year. It's a continuous learning process as a way of working and as a part of normal being. So there are salutogenic objectives under health professional education. One of objectives is the salutogenic capacity that can be expanded as part of the professional training. This learn can be applied after training such that salutogenesis capacity is strengthened and reinforced during the course of one career. The overall objective is not the healing of the diseases, but the facilitating and supporting health promoting processes, leading to an individual on groups adopting coping and enhanced case of well-being. This is the most important concept in salutogenesis. We must try to understand. It believes on the processes of good activities that overall the years and decades will contribute to the salutogenesis. The consequence of health promotion initiatives are not just dependent on the activities themselves, but on how one implements them so that it can benefit the others as well as the society. So relational competencies is based on the expanding their theoretical understanding. The students need to reflect upon and make use of their own practical experience in a variety of exercises. The goal of this relational competence in salutogenesis is that students should develop practical skills and relational computational skills when it comes to supporting and promoting health promoting processes, one-to-one and at a group, then successfully at the community level. To find that relational competence is the key of succeeding in this endeavor. Now, of course, definitely in a health professional institutes like us, to support health professionals in developing their salutogenic understanding and health promotion skills, there is a need for more higher quality research and wider distribution of the resulting knowledge. Hence, there is a need for health professionals to take on more salutogenic and person-centered in order to understand individual needs in light of the context that they are part and assist in keeping people well and living healthy lives. So for that, self is the most important thing. Changes in the self, changes in the activities of the self, that is self-tuning, it plays a crucial role. The concept of self-tuning has evolved from exploring in depth using inductive qualitative designs, the nature of job engagement, and the investigation of how job engagement is maintained and promoted. When the inner drive of the healthcare students resonates with his or her profession and finds its expression in his or her current work, it creates an inspirational force which sustains and enhances the experience practices. The most important objectives of this salutogenesis, it prepares to students to remember always to the understanding that health is not an isolated or activity of 1 or 2 months or year activities. It is health as a continuum, never-ending process. In the process of stresses and tensions in the everyday lives, and need to understand the person in his or her context and the activation and use of resources to counter stress and tension one faces in life. And this goal of adaptive coping and enhancement of health and well-being. So these are different components of the perspectives. In essence, after adopting or making this process of salutogenesis as an integral part of the life of health, what are the outcomes? Outcomes can be knowledge, outcomes can be skill. In the knowledge, what outcome one is expected? The student has advanced knowledge of salutogenic model of health, has an overview of other salutogenic theory and relevant salutogenic research, and the student has knowledge of the phenomenon of health, disease, meaning, well-being, and quality of life in today's societies, and has a knowledge of health promoting processes in self, individual, relationship, groups, and in the communities. And skills, many skills, students have skills in using own practical experience as a basis for systematic reflection on health promotion processes, and also in supporting and promoting health processes in working with others. And definitely with this enhancement of the skill, they can critically evaluate choices of methods and their own role in health promotion work in communities, in the groups. Then another outcome is the general competence. The students has knowledge about this salutogenic perspective's relevance and value in relation to the discipline of health promotion, can critically evaluate values and ethical issues in applying salutogenic approach in practical health promotion research. And to conclude, a key outcome of training of students in salutogenesis that is expected that the students develop the capacity to manage himself or herself in the salutogenic way. That is self-reliant. That is one of the biggest expected outcomes in the salutogenic capacity of the student. And to facilitate this salutogenic development of introducing and working on increasing capacity called self-tuning, which is self-sensitivity, reflections, and mobilizing resources to improve one's own level with others. So one can view if you are well, if you are happy, if you are having good, healthy life, it will be applicable. You expect other components, members of the health community also will be healthy. So this is mostly principle of self-care, the principle that can be used by health professionals to patients and others to experience good health and well-being. That is, in salutogenesis, one emphasizes, apart from fine-tuning, again, there's a capacity to teach others with one's own experience following the process of salutogenesis. Thank you. Thank you very much for your patience hearing.
Thank you very much, sir, for that inspiring address where you have highlighted the importance of self-tuning and that the inner drive has to be brought out in our healthcare students as one of the highest levels of self-care. I am reminded of Mahatma Gandhi's statement of be the change you want to see in the world. And your whole person approach that has been delineated and the importance of how the salutogenesis can be implemented in educational science by the interaction between the management, administration, faculty, students, and all the stakeholders. A beautiful overview of salutogenesis and the importance of how this can transform our young future healthcare professionals. It is inspiring to listen to you, sir, and I must place on record the amazing inspiration and dynamism you have brought to SBV in implementing salutogenesis as one of the best practices and also having a copyright or a policy on salutogenesis for a healthcare university, which must be one of the first in India, if not the world. Thank you so much, sir, for sharing your dynamic and inspiring thoughts. We thank our speakers for today, our respected Professor Shyam Prasad Ji, the Honorable Vice Chancellor, Dr. NTR University of Health Sciences, our own respected and Honorable Vice Chancellor, sir, Professor S.C. Parija, sir, all the participants of today's SBV Connect, and our own SBV IT team, and the MapCon team, and the team that is putting together this event. Be with us for this event next month also, and keep the flag of salutogenesis flying high. That is what we owe ourselves and we owe Mother Earth. Thank you so much. Dhanyavad. Nandri.
Thank you.